An on-duty NHS nurse has been suspended for stealing 2 headache tablets from a hospital pharmacy. Franchesca Morgano, who worked at Arrow Park Hospital near Liverpool, took paracetamol and cocodamol without permission during her shift. Caught through covert surveillance in June 2022, Franchesca admitted to taking the medication, assuming it was allowed when feeling unwell. Hospital bosses noticed prescription medication was missing, prompting a police probe. Surveillance footage confirmed she took the pills on 2 separate occasions without written permission. Despite her reflections and apologies, the Nursing and Midwifery Council found her insight limited and suspended her for 6 months, citing a continuing risk to the public. They were not convinced she fully understood the seriousness of her actions or how to prevent them in the future. Franchesca had initially lied during an internal investigation, denying she had taken any medication while on shift. However, after being presented with CCTV footage, she admitted to taking the pills. She also confessed to taking a laxative, lactulose, while on duty on another occasion. As a result of the prosecution, Franchesca lost her job and home and now lives with her grandmother. She pleaded guilty to 2 counts of theft by an employee in December 2022 and received a 12-month conditional discharge. She was also ordered to pay costs and a victim surcharge. The council noted the hardship caused by her suspension but emphasized the need to maintain public trust in the nursing profession. They highlighted that even though taking paracetamol might have been common practice on the ward, it still required proper authorization, which Franchesca did not obtain. Franchesca provided a reflective statement during the disciplinary process, acknowledging that it was wrong to take medication without permission and expressing remorse.
Thank you for taking your time to watch that video there. It's quite a worrying one because after I've looked at the travail of this particular nurse that worked for the NHS, I began to ask myself, how many more nurses are going to fall victim of this particular incident? So I'm doing this video to be like a sort of learning curve for all nurses out there who are practicing, in various sectors. What are the lessons to learn from this incident? Sometimes as nurses, we are so compassionate and we're giving a lot, even when it is not really convenient for us to be able to look after our patients or clients committed to our keeping, and sometimes we can't juxtapose between sympathy and empathy, and we put ourselves in the line of fire. This not actually put herself in the line of fire. But what actually happened, look at that. On duty, she was having a sort of headache, and she felt the need to continue her care. Do you understand? So, and she was tempted to go and take, drug. That's quite a very wrong act, but I know she must have had a good intention. If I take this particular tablet, I'll feel relieved and I'll be able to carry out my duties. In this profession, we have a lot of litigations. It's just like walking on an eggshell every time because of the litigation surrounding this profession. That is why I'm making a clarion call for people to be very careful, people to be, very meticulous between every decision they take clinically, and especially people to be intentional, to look out for themselves first. In this job, you have to look after yourself first. Now, what is a policy in case you are working and you have an ordinary headache? What is a policy? What are you supposed to do as a nurse? Leave the shift, tell your manager or tell the most senior nurse on the shift, and submit yourself to the A&E. That is a policy. Go straight to A&E and submit yourself for assessment. You are seen by the A&E doctor who will now prescribe drug for you. And if you, at that point in time, cannot continue with your shift, you go home. You have to be empathetic, not sympathetic. And you have to look out for yourself. My advice goes to every nurse there. And I say to them, don't go to work if you are sick. Don't. My advice goes to every nurse there, and I say to them, don't go to work if you are sick. Don't take that chance. Look at the trauma this girl has to go through, for doing this. There is no explanation for her action. Do you understand? Even when the intention is what? Good. So sometimes we are caught in a dilemma where we have a good intention, but you need to override the policy or the protocol to do that. That makes it all wrong. So you must make sure in your course of doing good, in your job, in the course of executing your care, it must be by the protocol and policy and the laws of the country. If it goes against any of these by any chance, don't do it. This is a learning curve for everybody out there. And I want to tell all of you out there, keep safe. Keep being compassionate nurses. Keep looking after your patients. But at the same time, don't forget to play or walk by the book, because that will keep you safe. So I want to wish every nurse out there, every doctor out there, every, healthcare assistant, everybody who is working in the hospital looking after patients, I want to wish you well and have a safe working day today as you take the learnings from this video. Thank you. Bye.